Okay, hello everybody. This presentation is on the Educational Action Plan. This is an update to our educational corrective action plans. These are very similar, and it will be addressing any concerns and errors through education and correction. Okay, so what is an educational action plan? These are going to be a step-by-step action plan used to identify issues or concerns for education and correction. They're used to describe what actions we want you to take that will mitigate any concerns, so they're going to actually solve any problems that we find. They're designed and implemented to decrease any future errors, and your regional coordinators are the ones that are tasked with managing and monitoring any EAPs. So here's some actions that might require an EAP. So if at the end of the month, when you're turning in your temperature logs to NMSIS, we find that there's an unreported temperature excursion, that would be something we would assign an educational action plan. Of course, a failure to maintain a digital data logger. So if you're at one of our regional coordinators did a compliance visit and they found that your digital data logger was out of compliance, was they was out of date, then they would put you on an educational action plan to ensure that you had a in-date backup thermometer at all times, so that situation wouldn't happen in the future. Or another situation would be where your provider doesn't communicate your key staff changes. So say your primary and your backup coordinators both had walked out, and the provider of record didn't let us know. And so there aren't any reconciliations being made. There have been no orders. That kind of situation, we would definitely want to make sure that the provider was educated, and we do that through an EAP. Failure to provide any required documents and certifications by a due date. I think that's pretty explanatory. Any avoidable wastage. So avoidable wastage, an example of that would be, say, you're having an outreach and you're going to be administering MMR at your outreach. So MMR is a live vaccine, and we know it's only good for 30 minutes after reconstitution. And so you're going to be seeing 50 people at this outreach event. And so you decide that you're going to reconstitute all 50 doses at the beginning of the day, and you only have 25 people show up. So this would be a case of avoidable wastage, because those 25 doses were wasted right away. So we would give you an EAP and talk about how long vaccines last once they're reconstituted, things of that nature. Misuse of VFC vaccines, so that would be like using a VFC vaccine for an adult patient. That would definitely be a situation where we'd want to talk about who is eligible for receiving a VFC vaccine. Inventory mismanagement. So you're having troubles with your reconciliations, and instead of contacting the help desk or your regional coordinator, just putting in whatever numbers you can to get that green check mark and closing it. And so in the end, your on-hand inventory is a complete mess. So if this continues to happen and you're not asking for help, we definitely want to help you. And we would probably do that through an educational action plan. Inability to account for federally funded vaccines, that's definitely would be part of inventory mismanagement, and recurring reconciliation issues falls into that category as well. So we talked about this a little bit. So who would assign an EAP? Your regional coordinators would be able to do that, and they would be able to do that because they have contact with you through the, of course, you call them if you have any issues, or your compliance visits. The vaccine ordering staff, they have really intimate contact with your reconciliations, so they'll be able to send out an EAP for any problems with that. And then us at the immunization program management level, if we see any problems that we think should be addressed that way, we can do that as well. Okay, so how to complete an EAP. You will receive, a provider will receive a specific plan that's developed just for you to address your specific issue, developed by VFC or regional staff. It will have those non-compliance issues and exactly what we want you to do to address the non-compliance. Once you've completed those required actions, your primary backup and the provider of record who signed the agreement must digitally sign and submit the EAP to their regional coordinator within 7 days of receipt. Please continue to provide vaccination services, but know that not responding to an EAP by the due date can delay a vaccine order. So the EAP has 3 separate levels, and they're designed to be like escalations, and they escalate if it is the same issue that is happening repeatedly. Okay, so the first level is when a provider is out of compliance the first time on a particular issue. This will be handled with a phone call from from the VFC program or your regional staff. The second level would be if it's a repeating the same issue, and providers can expect to participate in an online meeting with your regional coordinator to remedy that issue and get one-on-one education. And then the third level is implemented with when 2 previous level attempts at resolving the issue within a year were not effective. And depending on the status of the case, the provider should expect on-site retraining. And most of the time that includes repeating the Chile training within 30 days of that third EAP citation. So why should you complete an EAP? Well, it will solve most of your compliance issues, and our goal is to empower and educate providers to manage their own VFC programs effectively. If a VFC provider has more than 3 EAPs on the same issue in a 12-month period, their site will be put into provisional status. This provisional status, providers will be given a specific action plan. They'll be given supplemental regulations and restrictions to ensure compliance. And those will be specific to what their non-compliance issues are. There'll be a specific time frame for these corrective actions. So usually that'll be like 6 months that we will put this site on a provisional status. Then if a site still is having issues implementing these corrective actions, then they can move into inactivation status. So inactivation can occur if the provider-specific corrective actions are not completed, ignored, or refused to be implemented. If a provider is inactivated, they're removed from the active VFC program participation, and they're restricted from ordering VFC vaccines. Providers can apply for reinstatement after 1 year after their inactivation is imposed. It has to be requested by the provider, and it will be considered at the discretion of us at the VFC program after we assess the request. Providers who are reinstated after inactivation due to noncompliance will remain in provisional status for 6 months, at which time we'll review the provider status, including adherence to all VFC program requirements. The New Mexico Immunization Program or the provider can terminate their VFC provider agreement at any time. Termination must occur, however, if the enrolled VFC provider hasn't ordered vaccine in 12 months, or if the provider is on the list of excluded individuals and entities from the Office of the Inspector General, or if the inactivated provider facility fails to meet or adhere to VFC program requirements after applying to be reinstated. If a provider is terminated from the VFC program, they also need to ensure that any remaining viable doses need to be transferred to another VFC provider so that we make sure those doses aren't wasted and they're used by the children of New Mexico. And that will wrap up my brief presentation on the EAPs, and please feel free to contact us for questions or concerns at any time.